We do quite a few programs. Okay. Okay, good evening, everyone. I welcome all my viewers today on Heart Mitra platform once again. As you are aware, Heart Mitra platform is created for all of you who want to live a healthy life, even with a cardiac problem, or if you have any family member who has a cardiac disease and you want to be making yourself fully aware. So this is the platform where you get right, scientific, and reliable information. Not only we post relevant information to all of you for your education, but we also invite renowned cardiologists across the country who can talk to you straight as a friend, and you can ask them the queries which are there in your mind. So please feel free today not only to listen to our expert, but also if you have any queries, please put them on the chat. I'm delighted today to have with us Dr. Sumanta Chatterjee. So welcome to the show today.
Thank you.
Briefly introducing Dr. Chatterjee, he's from the city of Kolkata and he's a well-known cardiologist out there. He has completed his MBBS and MD from the medical college in Kolkata with gold medals. And after that, he did his super specialization, which is DM in cardiology, where again he topped his institutions. So you can, fully rely. You know that you're talking to the right expert today, and he has various research papers as well as publications to his credit in India and across the world as well. Currently he is working as a consultant interventional cardiologist in AMRI hospitals Dhakuria in Kolkata. He has expertise in complex angioplasties, doing performing them, and he likes to use the latest technology as well. In the month of November, we celebrate or we observe the World Diabetes Day as well, or World Diabetes Month, and therefore today we thought of bringing this topic to the discussion for all of you, that how all of us as a patient or as a caregiver or as a common man in the society, we should be protecting our heart, if we have diabetes. And it's a very pertinent subject and topic. So before we take on the questions of the audience, let me, invite for the opening comments my expert today, Dr. Sumanta. Over to you for your opening comments.
Thank you, Mr. Mehra. Good evening, everybody. This is for everybody, basically, who are mainly having diabetes and heart disease, or they are having strong family history that they can develop heart disease. So we know that diabetes is a killer vascular disease. It's a killer, number one, and it's a vascular disease. That means it's a hormonal disease, but it affects the vessels, heart vessels, mainly causing heart attack, brain vessels, mainly causing stroke, kidney vessels may be causing dialysis dependence or kidney failure. So most of the cases we know that diabetes produces this kind of mortality and morbidities, where people getting admitted for any emergency situation in diabetic patients are from cardiovascular disease or from cerebrovascular disease, from brain, heart, kidney. These are the things. So we have to protect our organs. Whenever somebody is having diabetes, they have to protect their organs, namely heart, kidneys, vessels, brain. So this is our topic today. So with diabetes and heart disease, we can live peacefully without any events, without any hospitalization. Maybe you can reduce or prevent or defer your hospitalization or defer your events. That's the main crux of today's topic. Okay.
Yeah.
What?
Yeah. Thank you, Dr. Sumanta, for your opening remarks and setting the ball rolling. We all know that when someone is having diabetes, it's a comorbid disease, and patient may have multiple problems in other organs as well. And of course, heart is one of the most important organ in the body. So how specifically heart is affected because of diabetes? What is the correlation between the two? If you can tell us in simple language, so that our viewers can understand this.
Sure. So it's a very important and good question, that how diabetes affect heart. The two spectrum of heart disease are there, which can be produced or which can be added in a logarithmic manner due to diabetes. That is, one is heart attack. Heart attack means blockage in coronary arteries. So heart is the generator or pumping organ of our whole body. The heart pumps blood, that is oxygen and some nutrients to all over the body. Heart has three vessels, three arteries, namely coronary artery, 1, 2, 3. They supply heart muscle. Heart is a muscular organ, and these three vessels supply heart. So if one of these vessels get choked, get blocked, then heart attack develops. That means the muscle which is being supplied by that particular artery, that artery is getting blocked. So that muscle is not getting oxygen and nutrients. So that muscle is dying. That is heart attack. So that is a complete occlusion of that artery. That is around 90 to 100% occlusion that causes heart attack. Before that stage, maybe 50%, 60%, 70, 80% blockades are there, for which patient symptoms, feel symptoms like chest pain. Whenever they are at rest, they are okay. But whenever they are exerting, maybe walking, talking, or jogging kind of thing, or running for a bus or a train, then they are experiencing chest pain, somewhat chest discomfort. 3 months back, I don't have that much feeling that I have a chest problem or heaviness or chest discomfort, some amount of uneasiness whenever I am exerting. But now I am having this kind of thing. So this is a symptom that your arteries are getting blocked. Your arteries are having some amount of blockage. This is called coronary artery disease. The one spectrum is heart attack, the other spectrums are chronic stable angina. This is one thing that diabetes produces. The second thing is heart failure. That means heart has a capacity to pump out your blood to your brain and your legs. If this heart function gets hampered, heart cannot pump out so much efficiently to all of your organs. This is called heart failure. This heart failure is also can be produced by diabetes, maybe single-handedly or with other multiple risk factors: pressure, blood pressure, obesity, diabetes, cholesterol, high uric acid, metabolic syndromes, and maybe with some viral fevers also, like this COVID, like dengue. They also produces this kind of heart attack. There is no relation of diabetes within these things. So diabetes in these two spectrum of heart disease, they are in maybe linear or logarithmic relation between these two: heart failure and coronary artery disease or ischemic artery disease.
All right. So I think you hear Dr. Sumanta explaining to us what is the correlation between diabetes and the heart disease, and definitely the way he has explained us, there is a strong correlation between the two. So let us take some, the real time situations and the questions which we get from the patients. Now, if someone is already having an existing cardiac disease, whether, it's a high blood pressure, or maybe, he's having some, gone through some procedure as well. Now, for example, if a cardiac patient who's like already on the medication, now he gets diabetes, there's an onset of diabetes happening him. And so is it a real cause of worry for him, or, how should he handle this situation and what he should be doing?
Yeah, it's a definitely a good question. When somebody having heart disease, specifically this heart failure and heart attack like situations like ischemic heart disease, coronary artery disease, I have undergone some heart surgery like bypass surgery or stenting. If this is the situation, even if patient is having stroke, this is the same spectrum. When there is a block in heart, this is called heart attack. When there is a block in brain, that is called brain attack or stroke. So whenever somebody is having disease in arteries, like heart attack, like ischemic heart disease, when they get diabetes, they are detected with diabetes, they should be extremely cautious, because the diabetes will aggravate their disease situation in longitudinal way. So diabetes, along with other risk factors like your thyroid, hypothyroidism, like your blood pressure, along with your blood pressure and other risk factors, will aggravate your heart disease situation. So in this case, along with your fasting blood sugar, PP blood sugar, and HbA1c reduction, with your whatever medicines you are having, There are some medicines, there are few medicines which are discovered, which are launched here within last 5 years to 6 years. They are they may be the weak, or they may be the weaker or more or less potent drugs to reduce your blood sugar level, but they are enormously beneficial in heart front. They have the capacity to reduce your heart events, they reduce your heart attack rate, they reduce your further hospitalization, they reduce your stroke rate, they will reduce your heart failure hospitalization, they reduce your symptomatology from heart failure, they reduce your respiratory distress from heart failure. So these medicines we are coming across for the last 5 years, these are extremely important. Every diabetic patient having heart disease should get those medicines. So people should be aware that these are kind of medicines which may be weak drugs to reduce your blood sugar, but they're extremely potent to reduce your heart attack, to reduce your further vascular events. You should ask your doctor that, doctor, I am a heart disease patient and I am also having diabetes. So maybe you can give me those medicines, newer generation medicines, newer generation blood sugar medicines, namely SGLT2 inhibitors, GLP-1 analog. These are the medicines where they produces good effects in your heart. They can reduce your body weight, they can reduce your blood pressure, they can in a good way modify your cholesterol level. Along with that, they reduce your blood sugar level. So they are extremely important medicines. Everybody should be aware that these medicines are there nowadays. Before 5 years, maybe 2016 or 2017, these medicines were not there, not in the market, not in India. But now we are having those medicines. So everybody should be aware. Mass awareness is important here. They are needed.
Yeah. So thank you very much for explaining, sir. If I may ask you, from the patient's point of view, general information, how many, you would be having a lot of patients with you. So what percentage of your cardiac patients also have diabetes with them?
I think more than 50%, more than 60%.
Okay, so I think that's a big overlap, and therefore, a huge
Big overlap.
correlation as well. So let's now take take a perspective of a diabetic patient who doesn't have a cardiovascular disease right now.
Sure.
So what is, what he should be taking care of? What is the percentage risk of a diabetic patient that he will also develop a cardiac problem? And then, can he delay this or anything, you will advise a diabetic patient on this?
Sure. The thing is that every diabetic patient will be developing vascular disease, be it in heart, be it in brain, be it in kidney, be it in legs. Definitely, they will develop. But there is a time frame, time gap, and your drug regime and your uh, impact of your glucose control. The three things are important: time frame, your glucose control level, how strict you are controlling your glucose, your drug regime. So these three important factors are there, and your other comorbidities, other risk factors. If you are a smoker, if you are having some kidney disease or kidney deterioration, if you are having strong family history that your father, your mother, or your next of the kins are having cardiac disease, there is an extreme chance, definitely. But you can defer, you can postpone the vascular disease. How? Number one, by stricter control of blood sugar. Definitely, your blood sugar level, HbA1c level is controlled throughout. So definitely, you can prevent, or you can defer these vascular events by 1 decade. So somebody developing blood sugar at the age of around 60, 65, if usual time frame is around 1 to 2 decades. So if anybody is having, develops diabetes around 60 years of age, the usual time frame that around 70, 72, 75 is the age where you usually diabetic patients develop vascular diseases. Vascular diseases, maybe it in the retina, legs, or heart or brain. But with stricter control, he can defer by another decade. So above 80, he is getting those things. So it's, productive life is getting lengthened. So by 2 or 3 methods, number one is stricter control of blood sugar. Number one. Number two is healthy lifestyle and healthy diet. Definitely, these are very much important. Next, control of other associated risk factors like pressure, like thyroid, like uric acid, like obesity, like your smoking, like alcohol. These are the things, associated risk factors. Definitely, they should be carved down. And your regime, drug regime, what drugs you are getting. I already, spoke about this thing that there are some 2 or 3 spectrum of medicines are there, drugs groups are there. You should be taking those drugs in, diabetic patients, whoever having other risk factors like these risk factors, obesity, smoking, hypertension, or you are having strong family history of cardiac disease. So there are some algorithms. If I think, if your cardiologist or your physician think that you may develop your heart disease within 1 decade, your chance of developing heart disease is more compared to average, then they should add these two, these two anti-diabetic agent from their basket. They can postpone your heart disease. They can postpone your heart blocks by another 5 to 10 years. So these things should be kept in mind. Awareness should be generated.
Yeah, and I think yeah, I think Dr. Sumanta makes it very very clear to the viewers today, and I think the take home message is that any patient who's having diabetes, there is a high probability that he may have or she may have a cardiovascular disease as well later on in the life. But then if you are able to manage your diabetes, control your blood sugar levels, manage a healthy lifestyle as well, then you can delay the onset of any cardiac problem easily by more than 1 decade. And I think now he has raked this point second time today itself, that there are medicines available today which can take care of both your diabetes as well as your cardiac problems. So please do go and have a discussion with your doctor on the same. Sir, there are some, misconceptions, or I don't know whether they're facts and myths. Probably, you are the right person to tell us. It is thought that, people who are having diabetes, so they are at a higher risk of things of like silent MIs and those kind of things. How technically correct is that, and what is your advice to the patients on this, so that there is no fear of this, but they know how to take care of such a situation?
I don't. I guess this silent heart attack are somewhat misnomer, but the thing is that the amount of chest pain varies. It's not that in heart attack everybody is having, tossing kind of or crushing kind of chest pain, severe chest pain. It's not that. Maybe some patients develop that much crushing chest pain and all those things. That is, everybody can guess that this is something going on. This is something serious going on. But most of the patients, more than 50% of the patient, perceive maybe some kind of chest discomfort, some uneasiness, some kind of palpitation, maybe respiratory distress, some heaviness in chest along with sweating. So previously I don't have that much symptom, but now for the last half an hour I am feeling just kind of a discomfort. Some discomfort is going on, maybe in the heart, maybe in this kind of a central chest, or in the left arm or the right arm or the jaw, with some a bit of sweating. Just 15 minutes or 20 minutes, and then I felt okay, kind of thing. So this is the usual presentation. This is the usual presentation, and diabetic population, women, and elderly population more than 75 years of age. These are the subcategories where this kind of less symptomatic MI occurs. This is usually the called silent MI. Some 15 to 20 minutes of discomfort, and then everything got normal. And then again after 10 days or 15 days, respiratory distress and other symptoms develop. Usually patients go to doctor that after 10 to 15 days. And then with ECG and echocardiography and all sort of things, we came to know that that day event was not that much benign. It was a heart attack. But we know heart attack is having a golden period. If that 24 hours or 12 hours golden period was there, if you visited doctor, cardiologist, and hospital emergency, and that vessel was opened up that time, so probably things would have been better.
Okay, so I think the message is clear that a silent MI or heart attacks are a sort of a misnomer. Even though a patient may not have severe chest pain, but still there would be some symptoms
Some
like
symptoms will be
doctor.
there.
So I think as a, if you are a diabetic patient, so you should be on lookout that if you have even the minor symptoms like this, which Dr. Sumanta told us, so don't take it lightly. Probably, you must consult a doctor, a cardiologist nearby, and be on a safer side. So thank you very much, sir, for explaining this. These are very, very vital
Thank you.
things, for a common person to understand. Let's talk about, sir, those patients, who have undergone a cardiac surgery, for example, or a cardiac stenting. They have gone through the procedures. Now these are definitely, we say that, have an advanced disease, and they are at a higher risk, even though, you, after the procedure, you would have, made their life better. But if such patients, what is your advice if they have diabetes as well? So are there any special, things which they should be taking care of in such a condition?
No, I mean, guidelines are the same. Whether you are having 50% disease or you are having 100% disease and you are having, CABG, I mean, bypass surgery on place or stent in place, the guidelines are same. Stricter control of your all risk factors, stricter control of your diabetes, give importance to the special group of these medicines, and healthy lifestyle. Definitely, dietary management and lifestyle management, maybe some counseling from the psychiatric point of view, or a psychological point of view. These are extremely important. Most of the patients get depressed after this heart attack on major surgeries. So that those elements elements should be taken care of. So guidelines are same, be it post-surgical kind of thing or post-angioplasty. But there is a fear after this major surgery or major intervention. There's a everybody. I mean, in family, the fear looms that I have this kind of thing and a surgery kind of thing, and I am having diabetes. So what to do? So if these surgeries are, done in a timely fashion in a good skill hands, you need not to worry. But in future, maybe down the lane, after 5 years, after 10 years, another event should be carved down. That's why you should follow these guidelines. You should follow the heart healthy practices along with your lifestyle, along with your drugs, and curbing down other aspects.
Mm. You mentioned about, sir, how the patient should be taking care of his diet or lifestyle management. Although I know these are very vast topics in itself, and very difficult to, put that in lesser words. But would you like to, about both, about, the diet which patient should be taking, or the lifestyle changes, which he should be making? Anything you'd like to share as your guidance to the patient here, briefly?
These are the vast topic, and I mean, this dietitian and the renal parameters. I mean, these things are not that much simple. These are complicated and complex one. If the patient is having renal dysfunction, their diet and lifestyle is different from the, diabetic patients not having any renal dysfunction. But as a whole, you can stick to these things, that our indigenous home made food is the ideal one. Avoid junk foods or uh, fast food kind of thing. Reheating of oils or reheating of food is harmful. Prepare a small amount of food, small amount of serving, and have it. So again, reheating the, lunch. Lunch. Prepared food in lunch, and then you are reheating that thing during dinner. That is to be avoided. And white oil and mustard oil, it can be mixed in 50%, 50% kind of thing. More than 3 liters of water, lesser amount of your sugar, lesser amount of your salt, increase the amount of your potassium, namely your seasonal colorful colored fruits or colorful fruits. Every serving should have some salads. Avoid alcohol, avoid smoking. Have a very good tight sleep, more than 6 hours, 30 minutes a day, 5 days a week. Exercise, aerobic exercise, just like you're swimming, gymming, or jogging, brisk walking to sweat it out. Yoga for stress buster, or this pranayama or asana, whatever you practice. Uh, your good amount of sleep, more than 6 hours, meditation. So these are the usual 10 or 15 commandments that
Mm.
are dictating the rules of heart healthy lifestyle and dietary management kind of thing.
Yeah, very, very aptly and, You have very summarized beautifully on this, sir. For the viewers who have just heard him saying about the dietary planning and the lifestyle management, if you would have missed out, or forgotten something and not made a note, this recorded session is going to stay on Facebook forever on this page, and you can always, go back and understand and learn it again, that what the doctor has advised on this. So one last question, we will take before we move towards the conclusion of today's conversation. So now, if a cardiac patient has got diabetes and his blood sugars are a little haywire, so what he should be doing? Is it necessary for him to consult another doctor, a diabetologist or cardiologist? Like expert doctors like you are well versed to manage this situation overall. I know this can be a little controversial topic for you as an expert to say, but I think for a patient it is very important that he wants to understand this.
So from my perspective, I can say this: stick to your physician, general physician, medicine consultant. Definitely they will be the primary uh, checkposts where you should visit every now and then, maybe every 3 months or every 2 months or whatever. So what they're giving the guidelines to you, stick to it. But once in a while, maybe if he is saying, or your physician is saying that you are having cardiac disease, or you are prone to develop cardiac disease, then I think once in a year visit to a cardiologist may be done. After doing an ECG echocardiogram, your physician thinks that you may need a visit to a cardiologist because you are having a strong family history. You may develop cardiac disease sooner. Then it is better to go for a cardiologist at least once in a year. If you are having cardiac disease, definitely you should visit your cardiologist regularly. In diabetes perspective, I think physicians will do their regular and primary basic job, definitely. But once in a while, maybe 1 year, you should visit your endocrinologist. But because it's not only your blood sugar, your holistic approach to your health, your sugar and other comorbidities. What's your peripheral neuropathy? What is your status of your legs, foot care, peripheral neuropathy, your diet, your psychological counseling? So these holistic approach usually endocrinologists provide in their chamber. These 2 or 3 tables are there, questionnaires are there. You just put a tick, and then algorithm based the computerized system is there. This scoring system will be there. So you are having foot problem, you are having nerve problem, you are having your checkup of your regular checkup of your retina, whether retina is getting involved from your diabetes, there is a diabetic retinopathy. So these are extremely important. So once in a year, visit to an endocrinologist is also important.
Wow. I think very, very nicely explained again on this. And I think in last 25 minutes or so, Dr. Sumanta has very comprehensively discussed today and shared with the viewers that how they should be protecting their heart while they are having they get diabetes as well. Generally, when we go to our doctors, they're very busy, and they may not have so much of time to talk so comprehensively. Today we must be thankful to Dr. Sumanta Chatterjee that he took out his time, and I think he has discussed in detail all the aspects related to this topic. Before we conclude, sir, any summary comments which you'd like to make, or anything which we have missed to share with the audience? Maybe a final word from you before we thank our audience and sign out for the day.
Diabetic patients, I think, be patient, have a very good diet and lifestyle modification, stick to your homemade indigenous diet. You should have some awareness regarding your numbers. What should be your fasting PP and HbA1c? What should be your blood pressure? What should be your uric acid and creatinine level? Because in diabetes, these numbers are having lower threshold. If somebody is having blood pressure, our target is around 140/90. But if in a diabetic patient, we target 130. So you should know your numbers. That's all. Thank you. Have a safe and healthy life ahead.
Great. Thank you so very much, Dr. Sumanta. And I must thank at this time all our viewers who connected live or who would be viewing this session later on as well. If you have anyone in your family or in your friends who is undergoing such a situation, a similar situation, you can very well share this link with him so that he can also listen to the expert and make himself wiser on how to manage such a situation. So with that, we thank all our viewers and we thank Dr. Sumanta Chatterjee. If you want more advice from him, he's available in AMRI hospitals, Dhakuria, Kolkata. You can contact him there. And with this, we will thank everyone and good night.
Thank you. Good night.